When I got my diagnosis, it was kind of, I think it was through a period of dealing with someone I was engaged in a monogamous relationship with, so it was kind of shocking. But at the same time, when you're from a community where people keep on saying like this is expected, this is what's going to happen. What do you expect? You're queer. You're trans. Like, so it kind of becomes like this manifestation of what folks are saying a Black trans woman life is going to be. And so it's very unfortunate, right? But at the same time, that's one of the reasons why I'm very passionate about shifting narratives. I've always been involved in HIV advocacy from the time that I heard about HIV and AIDS. I had an uncle who passed away from HIV, but I remember when he was really sick, I was one of the few people that was not scared to take care of him. So it really just really resonated with me that, that HIV is something that I may have to deal with one day. And like I needed to like really get involved in that work. And so I got involved like with ACT UP. I was one of the few Black queer person in ACT UP, especially when I was in Atlanta, Georgia. Wasn't too many Black folks who were involved just because Black folks were too busy living their daily lives and didn't have the time like our white counterparts did. The New York Transgender Advocacy Group was founded back in 2014, and it came out of a need for trans women, particularly of color, to have a place to center policies. Too often, what I found was that oftentimes when folks talked about specifically Black trans women, it was these cascades of 1 out of 2 Black trans women is HIV positive, but not giving really context of why that is. And so, like, if we're not addressing policies, we're going to continue to see those cascades and those disparities remain the same. A lot of the issues that we're dealing with are not going to be resolved by simply HIV testing and passing out condoms. There has to be a nuanced approach to each community. The African American community is different than the Caribbean American community. It's different from the Latinx community. There has to be an understanding of how historical trauma has impacted our community and how that shows up in how we have agency over our bodies. So if you're dealing with trauma and depression, you're not likely to care about using a condom or not. Well, housing, employment, and health are very important to the trans community. But how we look at employment has to be different. So it's not the traditional 9 to 5 type of employment. A lot of trans women, especially here in New York City, are already on various type of like SSD, HASA, which is an enhanced type of welfare for people living with HIV. So they're penalized whenever they make over $400 a month. Employment is very hard for folks who have been discriminated. They are not used to structure. And so a lot of people want to create like this back to work type component to getting services, but they're not really thinking about like a pre-job training program, understanding how to address triggers and how triggers may show up for TGNC folks of color. Most folks who are engaged in sex work, they are doing it because it's something that validates them and empowers them. It gives them agency over their bodies, over their lives. Some other reasons why trans women engage in sex work is just lack of opportunities. When you have a lack of opportunities where you can go and fill out a job application and they're looking at your application and looking at you and laughing and then throwing it in the trash can in your face, you're not likely to go to another job to fill out because you're not like, why? So sex workers must be uplifted. Black trans women who engage in sex work, that is not a bad thing. It gives them agency over their lives, and that is something that we should be respecting. It's something that we should be protecting. So sex workers don't need to be rescued. You probably heard this before. They need protections. They need support. So we need to make sure that we're doing that. Before 2002, there was a lot of concentrated effort by the CDC to really make sure there were a lot of prevention programs. Unfortunately, what they found when they went into partnership with Big Pharma is that they made a lot more profit of aftercare. Once folks had the HIV diagnosis, they would be able to partner with doctors, medical facilities to really push their medications on the community, and primarily Black and brown communities. And because Black trans women have one of the highest disparity rates of HIV, my community is one of the communities that are kind of like the desirable community to really focus on. And so it's unfortunate, but what that has created is what is called like HIV privilege. If you're HIV positive, you are afforded housing in New York City. There's employment opportunities for you that you don't get when you're HIV negative. When Black trans women and trans women of color see trans folks or anyone who's HIV positive getting access to housing, access to better health care, employment opportunities, it's kind of like, well, what's the use? Why should I bother staying HIV negative? So we need to make sure, or I should say the government, they need to make sure that they are doing just as much investment in communities that are high risk to make sure that they remain HIV negative. Because that's one of the things I really don't want to see, more Black trans women becoming HIV positive simply to have housing. We have to stop that. There's been like this ongoing conversation within the trans community in regards to like Black trans women taking up too much space. These are some of the allegations put out there by Black trans men and trans men, period. Black trans women tend to get a lot more funding because we have been the most vocal and about issues that are impacting our community. And so unfortunately, this has created this resentment from a lot of our trans masculine peers of we're getting too much like spotlight. And so that has to be addressed because we're in this together. I want to uplift all of my amazing trans folks, whether they're male, trans masculine or trans feminine. We need to do this work together. But Black trans men have to be a lot more vocal and talk about the issues that are impacting them. When it comes to the trans community and AIDS, what we need to really make sure we're doing is reshifting resources. Audre Lorde, I love this quote from her, you cannot dismantle the master's house using the master's tools. And what that means is we cannot continue to invest in organizations that are not prioritizing the trans community. So if you are funding for trans services, you should prioritize trans-led organizations first, especially trans-led organizations of color. That's really important. We are boots on the ground. We know what the issues are impacting our community, and we will prioritize our community and not see our community as an afterthought, and that's very important.